All right, good morning, everybody. Thanks so much for being here. And first, want to thank the community health centers for hosting us today, and thank them for all their great work that they do across Vermont, providing health access to so many Vermonters, working Vermonters, retirees, and doing a lot of that great work right here in the old North End as well. So thank you very much, Jeff and Adam and the whole team for having us here. We're here because, unfortunately, too many Vermonters are facing a really unfair situation. They're facing a challenge between paying skyrocketing premiums or going without health insurance and risking financial ruin and a health emergency. Cuts to the Affordable Care Act and the decision by virtually all Medicare Advantage carriers to leave Vermont has created real uncertainty for tens of thousands of Vermonters, working Vermonters, families, and retirees. This uncertainty comes with a tremendous risk, the risk of losing your health coverage, which could have devastating health outcomes, but it could also have devastating financial outcomes for an individual and their family. At the Treasurer's Office, we experienced this situation firsthand. We are in charge of procuring health insurance for about 7,500 retired teachers across Vermont and actually beyond Vermont as well. The Medicare Advantage carrier that we had decided to no longer offer that coverage, and we were left trying to navigate a really complex area of health insurance. We did it with a team at the Treasurer's Office. We did it with insurance brokers outside of the Treasurer's Office. We had a dedicated and diligent work plan. We were able to get high-quality health insurance at a much lower cost. But that experience really drove home how complicated it is and how so many Vermonters don't have a team working for them to make sure that they have the right health coverage for the upcoming year. So that really brought home the need for us to come together and try to deliver a simple message and some resources. Similarly, myself, I was navigating a week ago my own dad's coverage. So not only was the group Medicare Advantage coverage leaving Vermont, but a lot of the individual coverage has left Vermont. Trying to navigate which plan to go with, what coverage he needed. He's getting cancer treatment right now. So it was very critical that he did not have any gap in his coverage. So for those retirees, for those that are losing their Medicare Advantage plan, make sure you find a trusted loved one, a friend, a professional. Call one of the carriers, get all of the information that you need, be proactive. You still have time to do this. And most importantly, from my perspective, make sure you don't have a gap in your coverage. Make sure you make these decisions before the end of the year. And particularly for those that are leaving a Medicare Advantage plan, make sure you're aware that you need to get a Part D prescription plan or you will not have your pharmaceuticals covered. That's really critical if you have pharmaceuticals that you need to take out of a hospital setting on a regular basis, or if you have a really dramatic health outcome that requires really expensive medication that you deliver at home. It can be really financially ruinous. And there are a lot of good Part D plans that are available to Vermonters at relatively affordable rates. Now, just in closing, before we hear from the great folks that we have assembled here today, we know here in Vermont there's a lot more work to do when it comes to health care and providing affordable and accessible health care that also is high quality as well. We need to invest more in trying to reduce the cost of prescription drugs, which are one of the big drivers of healthcare costs. We need to make sure we're expanding and making it more accessible for people to get a primary care doctor. I don't know how many others' experiences are, but new Vermonters that come often have to wait even years to get a primary care doctor off of a waiting list. If you talk to concierge doctors that provide services online, they'll often say, boy, and we got a lot of Vermonters that come and utilize our services because it's hard to get primary care. If we make those investments in primary care and around pharmaceuticals, we'll do a lot to reduce the costs that Vermonters are experiencing and expanding the access. It's why community health centers are so critical, because they provide so much access to primary care in our communities. So with that, we have a great lineup of speakers. We'll first hear from Mike Fisher, the healthcare advocate. Then we will hear, I believe, from Christine Oliver, who is with NFP, experienced professional in the healthcare field. And then we'll hear from our legislators, Senator Ginny Lyons, the chair of the Healthcare Committee in the Senate, and then Senator Rahm Hinsdale, the Senate Majority Leader. So thank you all for being here today, and I'll turn it over to Mike.
Good morning. Thanks for having me here. I'm Mike Fisher. I'm the healthcare advocate. This is a position and an office defined in statute to be a resource for Vermonters and to be something of a watchdog. You know, our job is to fight for improving Vermonters' access to care. That's hard this year. This is not a normal year. That's the top line message. There's a lot of changes affecting people's access to health insurance this year. Many of those changes are going to be hard for Vermont families. Believe it or not, some of those changes are actually going to be quite good for some Vermont families. So the top line message always needs to be, take the time, make the phone calls, go online, figure out how these changes impact you and your family. Now, if you've lost your Medicare Advantage plan because it's left the market, you have until the end of this year, you have until December 31st to get a new plan without a lapse in coverage. Now, it might feel to many people like, oh, I've got a whole month or most of a month to make a decision. Again, another top line message. The systems that are here to help Vermonters are stretched. My office is stretched. But so if you need help, it makes sense to make those calls now. It makes sense to get on it today. The other major open enrollment period that's before us right now is for Vermont Health Connect. And as the treasurer just said, there are major changes in that marketplace too. There are still some very good affordable plans available to Vermonters in the individual market in Vermont Health Connect. And there are also some Vermonters that are going to experience some significant prohibitive increase in their costs. Again, you have to call and figure out how it's going to affect you. And the deadline for the open enrollment period for Vermont Health Connect is this coming Monday, less than a week away. And so again, don't wait till Monday. It makes sense to get the help you need today. And we at the Office of the Healthcare Advocate are a resource to help people through these complicated times. Thanks.
Hi, I'm Christine Oliver, and I'm with NFP. We are an insurance broker firm. We help individuals and businesses meet all of their insurance needs and really help people make those decisions about finding high-quality, cost-effective plans, both for themselves and their employees. It's been a crazy couple years on the Medicare front, for sure, as the Medicare Advantage plans have left the market. So we had a big influx last year. Carriers left and everybody jumped into a plan, and now that plan's leaving. So as the treasurer and Mike said, people have to take action now. If your Medicare Advantage plan has left the market, you can no longer just wait and have passive enrollment. Like, if I do nothing, I stay enrolled in my plan. You must take action. And failure to take action will cause a lapse in coverage and certainly significant financial distress. As we see in all health insurance, cost is the key, right? So we struggle each day to find the most cost-effective, high-quality, affordable plan for people. It gets harder all the time. We still keep doing this work because it's important that people understand their needs to some degree, and we find a plan that best meets their needs and their budgets. We have been working, again, with this Medicare situation. Since October 1st, our Medicare specialist has probably been working 10 hours a day just meeting with Vermonters, trying to help sort out their situations. We have a couple out of Addison County that I think is a common example of what we're seeing. So we go meet with them, we look at the coverage that they've had, we try and match that coverage into something into the future. It turns out this couple ended up in a high deductible plan and the cheapest prescription plan they could get. They also wanted dental and vision coverage because they had it on their plan, but when you looked at the premiums, their fixed income just couldn't absorb it. So we talked to their providers and try and get the cost of preventive services. So let's see what that looks like. And it turns out it was cheaper for them to pay for preventive services out of pocket, so they didn't pick up a plan, which is good to know what they've budgeted, but it leaves a hole should they need services outside of those preventive services. So again, people are doing the best they can with the budgets that they have. There's just a lot of risk out there. We are also seeing a lot of people just revert to Medicare without picking up a supplement. Again, understand the cost situation, but the financial risk is significant because there's no cap on your exposure if you're in traditional Medicare without any of the supplements. So I want to urge you, as well as Mike did, if you have a Medicare Advantage plan that is leaving the market, please take action now. Look at your resources available to you. You do not want to lapse in coverage, so please take action by the end of the month. And you don't have to do it alone. Legal Aid has resources available to you. NFP has resources available to you. CMS has resources. I just urge you to take action now. Thank you very much.
Well, first, thank you all for being here, and thank you to our treasurer, Mike Pieciak, who is really shining a light on healthcare in the state and the needs that folks have right now. Medicare Advantage being one very significant issue for all of us. I have to say that our goal in the Senate and as the full legislature, the House as well, is to provide affordable, comprehensive coverage for all citizens. Having a Medicare Advantage plan disappear pulls away that support that we have had, that folks have had. It is sad to see. At the same time, I know that we have good folks standing here, and particularly here with our Community Health Center, with our legal aid, and with NFC, who are available to provide support. When the Medicare Advantage plan was announced, they're leaving the state, I can't tell you how many citizens called me. And it wasn't just citizens, it was also legislators. Ginny, what can we do? And I said, this is difficult for me to answer because it is a federally regulated program, a set of programs. I've been through Medicare. I know how complicated it is. But then to have to switch when you are an older citizen. I had a call from one person who was in her late 80s, losing her Medicare Advantage plan. She was totally incapable of going through the rigor and the complexity of finding a new plan. Fortunately, I was able to communicate with her legislator, send him some information, her senator, send him some information, and then finally connect her with Vermont Legal Aid. It is critically important that we all work together on this and that we act now. Vermont Senate Health and Welfare has passed bills that have short-term benefits for affordability. We worked with the treasurer to reduce medical debt by about $100 million across the state. We are adding what's known as reference-based pricing for hospitals to reduce costs there. We are looking in the future for a prescription drug bill, but will be a prescription drug card to reduce costs for Vermonters. That we'll be talking about that during the session. We have also put caps on specialty infusion drugs within the hospital setting to save money for people who need it the most. It's so difficult to predict one's own future. You don't know what you're going to need. And so sitting down and thinking carefully about who you are, who your family is, and what your needs are will be important going forward. To that end, we're going to be focusing on primary care. As the treasurer said, primary care is critical for prevention. And so if we can prevent some of the chronic diseases that we all face, in going forward and being aware of what our healthcare needs are, that will save us in the future and allow us to identify the supplemental plans that we need. So all of this message goes not just to the folks who are switching over from Medicare Advantage, but also to the younger generation to think about your own care and prevention. So I look forward to working with the state treasurer. I look forward to working further with our healthcare advocate. I am sending my constituents to the healthcare advocate on a regular basis, and also sending information out that I receive about Medicare to link people in with more simplified information to help understanding. So again, I urge instant action. I think everyone is saying that, and best wishes and good luck in finding the coverage that you each need. Thank you.
Good morning, everyone. I'm Senator Keisha Hinsdale, the Senate Majority Leader, and I want to recognize that we have Representative Bridget Burkhart and Representative Daisy Berbecco here with us as well from the local community. We need healthcare champions in all corners and all institutions, so we're really grateful for anyone showing up, seeing what our health centers are doing, and just making sure that anywhere someone can find an open door and a welcoming ear to their problems, that they know everyone is trying their best to make sure Vermonters do not feel alone in this moment. Senator Lyons mentioned young people, and I'm glad she did. It actually makes me feel a little old to say that Community Health Center of Burlington has been my primary care since I was in college, and I was in college before the Affordable Care Act. So knowing that I still had a place to go and having in the back of my mind what would happen if I was knocking on doors campaigning for the legislature and got hit by a car, is that experience in the back of Vermonters' minds is not necessarily one we've had to confront until now, watching many tenets of the Affordable Care Act unravel before our eyes. So every Vermonter I can think of is facing what is at best a quiet crisis right now in the heart of winter, when we know it's bitterly cold outside, and we're reminded that if people can't afford their heat, can't afford their food, can't afford access to good dental care, that shows up in their basic health. Healthcare will be expensive for Vermont, regardless of who's paying for it, if other systems are failing. And the best thing we can do is make sure that people know what their preventive care options are, so that we're spending the money on people's health and well-being and happiness, rather than on really big chronic issues or the stress of this situation down the road. I know that it's really hard even to pick up the phone and have that conversation with your brokers, with the advocates, with navigators, and with providers right now. I was trying to make sure that my slightly more affordable option for myself and my family came through yesterday in this end of this open enrollment period. And when I called in the afternoon into the Vermont Health Connect system, I waited on the phone for 20 minutes, didn't feel like a long time to wait. And then a very nice person at the other end of the line said, "Our entire system is down. Please call back tomorrow." And I know the pain in their voice was real, that they didn't want to have to tell people that they couldn't help them in such a stressful time. But it then means that that person has to work up the courage and find the time to make that phone call again and to hear what will be difficult news again. Some of you have heard me tell this story, but just a couple of months ago, I was waiting for my car to be serviced at a local dealership, and a woman, probably about 70, heard really devastating financial news. Her car was not drivable. She could not drive it home. And what she exclaimed out loud in that room was, "Healthcare is taking up all of my income. What am I supposed to do? I don't have a penny for a new car. I will not be able to go to church. I will not be able to get anywhere and do the things I need to do to keep myself healthy and connected." In that moment, myself and another woman in the room who was new to the state started helping her figure out her hospital bills. If you can mention it, you can manage it, as Mr. Rogers would say. And so we She didn't even want to make those phone calls, but we were able to get her money back from her health care bill and stop her payments going forward, because help is here. And as Senator Lyon said, we are doing our best to create a system that doesn't let anybody go without care. So just know, wherever you turn for help, there is some help available. There is some relief available. But it does take everyone breaking that silence and reaching out and making sure they know what that help looks like, and that there are a lot of open doors for you. There are a lot of folks who want to be welcoming in this really difficult moment, so you don't have to go this alone. Thank you, and thank you for being here and spreading this message. It does feel like there's very little we can do right now, except make sure people don't feel alone. The stress of that, the financial reality of that is much worse than reaching out and asking for help. There is help available, and we want all Vermonters to know that.
Well, thank you, Senator Hinsdale. Thank you to all our speakers and legislators that are here with us. Just again, the simple message: December 15th is the deadline for the ACA, Vermont Health Connect, for those that are looking to get coverage on the exchange. And then for those who lost a Medicare Advantage plan, you have until the end of the year to not have a gap in coverage. There's a little bit longer of a deadline, but you don't want to have a gap in coverage, so you have to the end of the year when those Medicare Advantage plans expire to both think about a Medigap plan that will help you cover some of those costs that happen in the hospital or doctors, and then that Part D plan that will help you with the prescription drug coverage as well. And again, as all of the speakers reiterated, folks, Vermonters are not here alone. There's assistance with the Vermont Legal Aid. They have a great website with information. There are private insurance brokers like NFP and others across the state that are there to assist Vermonters. Then also CMS, the Center for Medicare and Medicaid Services, the federal government, has information on their website. Encourage you to search that out. Do it with a trusted friend or loved one. It's always more helpful to get through these things when you have somebody else with you by your side trying to figure it out. So thank you all so much for being here. We're happy to take any questions that folks might have.
Do we know at its peak how many people at one point had Medicare Advantage plans before the collapse?
Yeah, about 50,000 Vermonters.
50.
Yeah, so the only Medicare Advantage carrier that I'm aware of that's in Vermont is Humana, and that's only in like maybe 4 or 5 counties. So 50,000 Vermonters, probably now just a few thousand that are going to be covered under Medicare Advantage next year.
I know we've talked about some of the challenging financials of some of these plans and how they've played out in our demographics, but can you just maybe speak broadly about why the marketplace collapsed overnight? I mean, was there a specific straw that broke the camel's back here?
Yeah, well, you know, it definitely was a long time in the making. If you look at Vermont Blue Advantage, which was the Vermont-based carrier that was associated with Blue Cross Blue Shield of Vermont and Michigan, you know, they had financial losses for years, and that accumulation of losses sort of led to their decision to not offer either group or individual coverage for next year. So those factors that lead to those losses are an older population needing a lot more medical care than was anticipated or expected. There's some reimbursement issues with the federal government that I know that they ran into as well. But at the heart of it, in Vermont, we need more young people to balance out our demographics. We need more young people and commercial payers to balance out the payer mix that we have between Medicaid and Medicare and the private sector. Because when we have so many payers in Medicare and Medicaid, it puts a lot of pressure on those commercial payers and those small businesses that pay those premiums, and makes them more likely not to offer insurance. And then when we lose subsidies, it makes it more likely people aren't going to get insured. So some of it's demographics, I would say, but it's also a nationwide issue that has been happening with Medicare Advantage as well.
I guess my last question, and maybe this kind of gets to the point that Senator Lyons was making about these being federally regulated plans, but these are private companies. I mean, how did we not see this coming? I guess, you know, here we are. There's about a month left until people have to switch over, buy a new plan. Should there have been more oversight of DFR, or should DFR had more oversight, or is this something that the state can even try to keep an eye on at all?
Thanks for the question. I think those of us who are in the middle of it, watching it unfold, could see it unfolding for a number of years. But I think it's also really important to respond. Everything about this is federally defined. How much Medicare Advantage plans pay for care, pay providers for the care, it's all federally defined. So you mentioned a state regulator, DFR, or people talk about the Green Mountain Care Board, or the legislature wondering what they may have done wrong to create this problem. In this case, this is all federal policy that led to this problem.
Can I just add just a quick comment? It was last session or the session before, I guess the session before, we did look at the difference between supplemental plans and Medicare Advantage plans and tried to express to the public those differences and the benefits of one over the other, knowing that Medicare Advantage plans are inflexible. You can't switch out and you can't go right to Medicare. And knowing that there are some other issues that I think the treasurer alluded to on pre-authorization. So, and we worked with the healthcare advocate in both the Health and Welfare Committee and the Finance Committee to try to get information out that would discriminate between supplemental and Advantage. And that's exactly what we've done. We've had information going out, but we can't do any more in terms of regulation. Not our job.
And I can't resist it because I've forgotten to say it up until now, and I can't believe it. There is one thing the legislature was able to do and did do, and I really want to appreciate, that plays out starting January 1st. It's not in place yet, but starting January 1st is new limits for the Medicare Savings Plan. So that's for low-income people on Medicare because they're older or disabled. There are new supports for them, and we think about 14,000 Vermonters will be newly eligible for much more affordable plans. So we're very appreciative that the legislature took that action, and I think all the legislators behind me supported it.
Mike, I think I know the answer to this question, but...
Oh, well, yeah, which Mike?
Oh, never mind then. If you're self-insured, and in fact, insurance companies, they reinsure themselves for calamity, is there anything that someone could take out, like you can imagine that health costs, because, a Medigap plan is going to be like, if you're married, it's going to be 2 car payments, basically, you just thrown on top of your existing. Is there any calamity kind of insurance plan that would cover, the first 50,000 or something like that?
Yeah. In this space, it's not really up to the state or private, it's federally defined in terms of what the coverages are. There are catastrophic plans in some cases that are available for younger people, but, the one thing about those that have lost their Medicare Advantage plan, just again from my own experience working with my dad, if you're switching not because your carrier left, but because you want to, oftentimes you're paying a penalty or a higher premium as a result. But when your carrier has left and you're forced to choose, it is actually often a little bit more affordable than you might expect. And it's also that guaranteed issue that is really important. So if you have a pre-existing condition, you're not being underwritten for the health insurance. So that also makes it a little bit more affordable as well. So I would encourage folks that are losing their Medicare Advantage to go and check what actually the monthly premium amounts are, because it could be a little bit more affordable than anticipated.
And if you miss the deadline and sign up later for the Medigap, you lose that pre-existing condition.
Yeah, you can, yeah. So that is sometime in early 2026 is when the deadline is. But again, in March. But if you wait till March, and you have an incident in January, then you have this gap of coverage. So that's why we're saying get it done before the end of the year, before your Medicare Advantage plan runs out. Well, thank you, everybody. Appreciate you all being here. And again, thank you to the Community Health Centers for hosting us. Thank you.
Thank you.
Thank you.
Thank you, Treasurer.
Yeah, thanks, Cindy. Thanks, Daisy. Yeah.
Thank you.
I'm Daisy Berbecco, Ranking Member of the House Healthcare Committee. and happy to be here at Riverside Community Health Center, announcing with Mike Pieciak some of the reminders that folks need to do in order to stay on their Medicaid plan, some of the deadlines coming up on the 15th, renew your Advantage plan, and sign up for get on the Health Connect. I just want to thank everybody for coming out today. Healthcare is going to be a top issue and priority for us in the House next year. We're going to be looking at how to improve access to primary care and, of course, addressing affordability of healthcare for everybody in Vermont. Thanks for coming out.
I'm Adam Greenlee, the Chief Medical Officer here at the Community Health Centers. I really appreciate everyone coming down to talk about this important topic today. And just to say that I think as medical providers, when we're focusing on the health care and providing health care of everyone on a daily basis in this office and in all of our offices in our organization and in primary care around the state, we recognize that our patients are really suffering with these agonizing decisions and trying to make those decisions. And while we try to be informed about it, this is not our area of expertise either as medical providers in providing that access to insurance information and helping people make the best decisions about that. We really try to do our best, but we really lean on these resources that were identified today as well at helping connect patients with the best information and the best resources for helping them make the best decisions for them. Thank you for talking about this important topic.